Hi, I'm Cherie Lindbergh, and welcome to Elevated Life Academy, where we share real stories of healing, hope, and transformation. Tune in to hear how everyday people are rising above and lighting the way for others. Hi, everyone. This is Cherie Lindbergh, and this is another episode of Elevated Life Academy. And we have Gilly Kahn here with us today, and I'm going to let her introduce herself in just a second. But we want to make sure that you're sharing this with whoever you think will benefit. What we're trying to do here at Elevated Life is help folks learn how to have an elevated life. And so we search far and wide for folks that have their own healing journeys and what we can learn from them. And so with that, I'm going to invite Gilly to introduce herself, and we're going to start with, what is your story? What are you bringing out into the world to help people?
Thank you, Cherie. Thank you so much for inviting me to be on your podcast. I'm so happy to be talking to anyone who's listening right now. So my name is Gilly Kahn. I'm a psychologist, a mom, and a writer, and I live in Atlanta, Georgia. I'm originally from Miami. And I have two little kids who are adorable. I call them my baby bears. Um, and I see individual therapy clients as part of a group practice in Buckhead. But I also started writing the other half of my time. And I just published my first book. It was released in September. And the title is Allow Me to Interrupt. A Psychologist Reveals the Emotional Truth Behind Women's ADHD. And it's what it sounds like. It's about the emotional dysregulation aspect of ADHD in girls and women. And I'm really proud of that. That's something I've wanted to do since I was really young, publish a book, and hopefully I can publish more. I'm writing for Psychology Today, and I've written for Attitude Magazine, and I also write for a few other magazines. So writing is my happy place in addition to working with clients one-on-one. And my clinical work focuses on neurodiversity, anxiety, depression, emotional dysregulation more generally. But I also see clients who struggle with obsessive compulsive disorder, body focused repetitive behaviors like skin picking or hair pulling, Tourette's. I also enjoy working with parents. So I like having variety in terms of different kinds of cases. And that works for me because I have ADHD too. And it's not that I get bored easily. I guess having a static 9 to 5 job is just not a good fit for me and I know that's true for a lot of other adults with ADHD. So yeah, that's me.
All right. Well, thank you. And I also have ADHD, so I'm going to love hearing more about your book. So please, congratulations, and please share more about that, because I know that that has been a phenomenon for many years that has not been really well studied and researched, and that the symptomology with women that have ADHD can look very different than with men. So please share about your book and what you're learning as you've published it.
Yeah, so I definitely feel like it's unfair that a lot of women are only now getting diagnosed. On the one hand, I'm happy that like better late than never, I guess. But from a lot of the women I've spoken to, and this is true for me too, I think there's still a lot of misunderstanding in terms of how ADHD can and often does present in adults and in women in particular. And so a lot of women are going out and seeking out help and diagnoses and are advocating for themselves. And they're bringing resources with them or whatever knowledge they've accumulated through their reading to their doctor's offices and presenting that and saying, this is something I've been struggling with since I was really young. No one has caught it, and I'm ready to get help now. And so that's kind of the reason that I chose to write about that topic. I knew I wanted to write, but the question was, what would I write about? And this just came to me immediately. It wasn't even like I considered other topics to write about. And it was mostly because I'm a psychologist, so I'm in the field, and so I often like recommend books to my clients, and I felt stuck anytime I wanted to recommend a book on ADHD, especially ADHD in adults. It's not that those books don't exist, but a lot of the books that are available are written in a way that's very academic, because they're probably written by people in academia.
Mm-hmm.
And I think there are a lot of things that I'm not so strong at, but writing is something that I enjoy, and it has always kind of like come naturally to me. So I wanted to write a book that was digestible, easy to understand, and fun to read. So the person, when they're done reading the book, they feel more confident and more informed about ADHD in women. They're given a few tips or skills they can use, but also it reads like a story. So it's not like hard to get through.
Mm-hmm. Mm-hmm. So tell me, if you wanted to share one thing that's highlighted in the book that you think is really helpful for women that are discovering that they have ADHD, what would that be, Gilly?
Yeah, I think the most obvious one, at least for me and for anyone in the space, would probably agree with me. It's the hormonal piece.
Mm.
Yes. So I think, now there's slowly like more research, especially in the area of like, menopause and perimenopause. There was nothing. And I saw maybe there was one study now that was
Mhm.
published in an academic
Mhm.
journal. There's some like research being conducted by Attitude magazine, but it's not published in an academic journal. But the people actually collecting the data or they're researchers, and they're very well respected. So whatever data they do present in their blog posts, I think it's valid and it's really helpful, I think, to read what they've come up with. But basically, the data basically confirm what we instinctively know. I think women are very intuitive. I don't just think, I know they are because there's research also showing that we tend to our gut hunches are often accurate.
Mhm.
And that we tend to be insightful, and that when we report on our symptoms, they tend to be, I think, consistent with other people like clinicians or parents.
Mhm.
And so, the basically like anecdotally, it came out as more of, I feel like right before my period, I feel worse, right? Maybe you experience more PMS, premenstrual syndrome, and so your mood is lower, you're more irritable, more on edge. You struggle more with concentration and forgetfulness. You
Mhm.
feel more like brain fog and fatigue. And the same is true for any part of your hormonal cycle, because women go through a lot of them, right? I mean, you get your first period and then that continues every month. And you get pregnant, and then that changes
Mhm.
your hormones. Um, you go through perimenopause and menopause. There are also hormonal conditions. I have PCOS, polycystic ovarian syndrome, and
Mhm.
that has been shown to be associated with ADHD and autism with neurodiversity. Yeah.
I didn't know that part because I too have PCOS. This is quite ironic here.
Yeah. And let me give you another kicker, migraines.
Ah.
So that's another, yeah. And all of it kind of, if you were to look for a common link, it's
Mhm.
estrogen. And that's
Mhm.
because estrogen, like the sex hormone, women, for those who don't know, like women have higher levels of estrogen. Men typically have higher levels of testosterone. And estrogen fluctuates throughout your cycle and
Mhm.
different phases of your life.
Mhm.
And so basically your menstrual cycle can be divided into like two parts. The first 2 weeks are the follicular phase, and
Mhm.
it's called the follicular phase because basically you're developing like more follicles. So that way you could potentially get pregnant
Mhm.
and inhabit a baby. And during that period, your estrogen levels increase. So that's why, typically during the first phase of your menstrual cycle, the first 2 weeks, you feel more productive and
Mhm.
happier.
Mhm.
You feel like your best self. But then after that, it all goes downhill if you don't get
Mhm.
pregnant.
Mhm. Oh, yay.
Yeah.
Well, I can attest to the whole menopause thing because I was really good at masking until menopause. And then forgetfulness just really kicked in, and it's been challenging. Like, thank goodness for an iWatch and an iPhone so that I can get alarms and reminders and things like that. So I've read the research, and that if you have symptomology that you've been masking, that in menopause, for many women, it gets worse. The ADHD and the brain fog, as you were saying, and the dysregulation, the disorganization, all that. So very, very interesting. Um, I'm interested in your title. Can you tell me a little bit more about the title of the book? Why that title?
Um, yeah, so I think it's a little bit not like a bit sarcastic, I guess, which aligns
Mhm,
with my personality because yes, it's a stereotype that women
mhm,
with ADHD or anyone with ADHD interrupts. But it's sort of like a passive interruption, or but it's got a little bit of pizzazz or, personality
mhm,
to it. I feel like it's like, allow me to interrupt. You're not really asking, you're gonna interrupt anyway.
mhm,
And then also it's just an interruption to the status quo and the understanding of ADHD in
mhm,
fields, or rather the misunderstanding. So you're basically, you're like excusing yourself, but also nudging your way in to correct any
mhm,
misperception.
mhm, mhm. Yeah, I thought it was clever. So your journey to understanding your own ADHD, anything you would like to share there? What it was like for you?
Yeah. So I think for me, it was a little bit unique because I started studying psychology at a young age in high school. It was in my AP psychology class, and then I just continued on that path. So I knew what ADHD was, and I knew what the other disorders were. I knew what the criteria were. And so for me, it was just more confusing because I knew what the information was, and I knew it wasn't really consistent with the symptoms that I had and what was challenging for me. Like, some of the symptoms did seem to fit. Like, it was hard for me to concentrate, especially on reading. So I've
Mhm,
learned a lot of workarounds. And oh, I was also forgetful. I mean, we can go into that, but yeah, I do fall into some of the symptoms, that a lot of them that are already present in the DSM-5 TR, which is the Diagnostic and Statistical Manual. That's the classification system that we use in the
mhm,
United States to diagnose mental disorders, if you want to call them that, and in most other countries.
mhm,
And so I kind of would flip-flop between different options because I knew something was wrong, or that some things were different about me compared to
mhm,
other people. And the closest type of, diagnosis, I remember even having this conversation with a friend and saying to her, like, I don't know what the hell is wrong with me. I was like, I guess if I had to classify myself, it would be generalized anxiety disorder because in the DSM, GAD is all about worry and just having a busy brain, and struggling to fall asleep at night, for example, because your
mhm,
brain is on and you're worrying. But the problem and the disconnect was that I wasn't really worrying a lot. It wasn't like it wasn't a catastrophe in my head.
mhm,
I wasn't a particularly anxious person when it came to things in general. I think sometimes I felt anxious in social situations. And we could talk more about why I think in retrospect it was more ADHD than social
mhm,
anxiety.
mhm,
But so that's where I was. I was confused. I knew something was off. I knew that my head was constantly working. I was constantly thinking about something, planning or ruminating a lot of times. And so that's why I was thinking, well, maybe I'm anxious and depressed, but I'm not really so anxious in terms of worry more generally. And so my depression diagnosis came first, just like it typically does
mhm,
for a lot of women. But I waited a while before going and seeking out therapy. And I finally broke and ended up going to a therapist after I had my daughter. It was my first child. And that's because one, I think my daughter was not an easy baby. I'll just say it. She was a difficult baby. And that was especially challenging for me because I also really struggled with postpartum depression, which is very common for women with ADHD because of the hormonal issues that I mentioned
Mhm.
before. So it was already like hormonal issues for me associated with low mood and hopelessness and loss of interest in activities. And I just did
Mhm.
not feel like myself. But then to make things even worse, like I said before, I have a history of migraine. And I say migraine because now that's more of the accepted term or classification in the community because people will say I have migraine headaches, but they're not just headaches. Like when you have a migraine attack, if you've had one, you know it is not a headache. This is,
Mhm.
some people have auras, like I don't, but I
Mhm.
would vomit regularly, like a lot.
Wow.
Um, and would be, stuck in my bed all day. Sometimes they would last 4 days, 3 to 4 days.
Wow.
And that's a big problem for someone who has especially undiagnosed and untreated ADHD, because then
Mhm.
I would fall behind. They started in college for me.
Mhm.
I would fall behind on my classwork, and then that would make me anxious.
Right.
And
It's
I
just
couldn't,
yeah.
yeah, exactly. Yeah, it would just accumulate, like
Mhm.
one thing on top of the other. And then I couldn't go out and enjoy myself. I couldn't relax. And that's really why I went and sought out therapy at that time,
Mhm.
because then having a kid on top of that, and I was in graduate school, I was in my PhD program.
Mhm.
Um, I remember when I walked in, she said, "Why are you here?" I said, "Because of my migraine attacks." Yeah. Um, and I don't think she really knew what to do with that.
Mhm.
Like a lot
Mhm.
of therapists, I
Right.
a lot of therapists, I don't want to say this, like they don't really have, I think, enough training, even when they do. Or sometimes they say they specialize in something and they just don't.
Mhm.
But it was better than nothing, and I remember being taught early on in graduate school that like a lot of what determines like therapy outcomes in terms of improvement in symptoms, I think it was like 40% of the client's outcome has to do with the rapport that you have with the therapist at a very basic level. So just having someone who listens to you, you don't have
Mhm.
to be an expert, can
Right.
help you a little bit.
Yeah.
Yeah. And so I found that that was true for me.
Mhm.
And so I just continued seeing her because it was someone to talk to. It was a start. Um,
Mhm.
and yeah, it helped a little bit. But so it was mostly working through like the depression that I didn't solely tie to the migraine attacks, but it was largely, I think, because I was struggling with that, and that was really interfering with a lot of other things that were related to undiagnosed ADHD.
Mhm. So when did you find out, or when did you like officially get diagnosed?
Yeah. So when my daughter started getting older, and as I kind of went through my program, I remember I would kind of fit in, like, I'm like, I keep, there was this thing I did where, and I write about shopping addiction in my book, where I would order packages or I would like get into these states where it wasn't mania. It wasn't, because I know what bipolar disorder is,
Mhm.
but it was just like sometimes if I would feel empty or, it was a dopamine kick where I would
Yeah.
order
Yeah.
stuff. But
Yeah.
then what I would do to follow up on that is I would consistently check for the package because that was a little bit of a dopamine kick. And I was like, is this OCD? Is this checking behavior? Like, because it's not
Mhm.
mentioned anywhere in the DSM under ADHD. But
Mhm.
I have a whole chapter on behavioral addictions in
Mhm.
my book, and it could so easily be explained under the umbrella of
Mhm.
ADHD. And that
Mhm.
impulsivity and that need to feel some kind of fulfillment or, excitement or joy. 'Cause
Mhm.
otherwise, everything just feels static.
Right.
And so that was one thing I thought about. So, but as I started reading and speaking to, actually, I write about her in my book also. I had a colleague who has ADHD. And so I used to talk to her about her symptoms. So then I learned about what is not really taught in graduate
Mhm.
school and what's not in the DSM.
Mhm.
And then the pieces started to fit. And so I would start to make comments to my husband. I'm like, well, I think I have ADHD. And he kind of like didn't really take it seriously. Like, and that's usually the case for a lot of people because they just don't really understand what
Mhm.
ADHD is. And so when my daughter was about 2 and then 3, we used to look at each other and say, like, this is not normal. She was always, you know, a lot. Like, she didn't sleep well, and her emotion regulation was just intense. It would take her a long time to move past. And I understand at that age, it's young, right?
Mhm.
And so kids are still learning these skills, and their brain is not developed to the point where they can even regulate them. But because I was working with kids, and because I did when I was an intern, my graduate program, I was working at actually like it was like a primary care location. It was a pediatrician's office. So I saw babies all the time and
Mhm.
toddlers, and so I would see how they behaved in the room, and I was just like, this is how a kid behaves, it's just confirmation that something was very different with
Mhm.
her, and that it really was legitimately difficult for us.
Mhm.
And so we agreed from an early when she was young, we're like, this girl has ADHD. But then, my husband would ask, like, oh, or say, I wonder where she gets it from. Like, and he would go back in his family, and I'd be like, from me, because I didn't have my diagnosis yet.
Mhm.
And so it was something I was reading more about, and then I just decided one day I was done. Like I already had my confirmation. This is genetic. My daughter's struggling with it. This is something I've thought about for a long time. I've kind of put it off because people with ADHD put things off. They
Mhm.
don't prioritize the important things often. And because I just didn't put myself first. And I still don't really do that. And it's a
Mhm.
problem. But my health was kind of to the side, and everything was going to, my education and my clients and now my child.
Mhm.
And it was just new for me. And
Mhm.
so I just kind of reached a point where I was like, I'm gonna go seek out medication. Like I need help today, because if I'm gonna be taking my daughter down this path eventually, like, first of all, I think I need to get myself managed. So that's when, yeah, I went and I saw a psychiatrist first virtually, and that was an interesting experience, but I don't want to get into it. But then I settled on my psychiatrist, who's my current
Mhm.
psychiatrist, and now I'm here.
Yeah. Wow. Well, and I remember um too when I went to go get medication and they tried to put me on Modafil, and I was one of those rare ducks that had allergy to the medication to where
Try
they
to
didn't
put you on what?
Modafil.
What's Monofil?
It's a genetic or generic. I can't remember which one it is, but it's a generic of one of the big ones.
Okay.
Um, but muscle constriction, like really bad muscle constrictions, can be one of the side effects. Do you have you done any research on the MTHFR gene at all that's connected to ADHD? Just wondering if that's
No, I haven't.
okay. Okay. So, maybe that might be the next thing to kind of take a look at because it impacts how you metabolize and detoxify in your body. And when people are neurodivergent, they usually have this gene. So, but just, thank you for sharing, listening to your story. It's just like you went through a lot, and it's your story is not uncommon with women, that this is how they end up getting diagnosed, that they end up self-diagnosing and then having to go and tell their doctor, this is what I think I have, versus it, coming the other way where, a teacher or an educator or something like that, early on. It's amazing that you were able to get through high school and you were in grad school and, you were in your PhD program before you had your own diagnosis. So you had to have learned a lot of adaptable skills.
Yes. Yeah. So I'm reading about, is it
Moda Modafil, yeah, or whatever, yeah.
modafinil, and it says it's
Yeah.
an amphetamine central nervous system stimulant used to treat excessive daytime sleepiness,
Mhm,
including narcolepsy, sleep work shift disorder. It's
mhm.
just interesting. I haven't heard of that one being
Yeah, they use it to treat ADHD.
Okay. Yeah, I'll look it up.
Yeah.
Um, yeah, so the medications that I'm familiar with, there's like two classes.
Mm-hmm.
There's methylphenidate in terms of the stimulants. There's
Right.
methylphenidate and then there's amphetamine. I'm just saying more for our listeners. And
Yes. Right.
so there's methylphenidate and then there's the amphetamines. And so for example, like one type of medication that would fall under the category of methylphenidate that you probably have heard of is Ritalin.
Yes.
And amphetamines would be something like Adderall,
Mm-hmm.
Vyvanse. And there also are options to either prescribe them as immediate release or extended release.
Mm-hmm.
An immediate release is basically, I explain it to my clients, is like taking an Advil because it basically stays in your system for like about 4 hours. You take it, and 4 hours later, the medication has worn off. But the problem with immediate release is that the peak is really high and then it's very steep
Mm-hmm.
in terms of effectiveness, and that can influence your mood and introduce like irritability. The other thing is that a common side effect of stimulant medications is appetite suppression.
Mm-hmm.
So, like, you might lose your appetite and suddenly feel starving once it has worn off. So, psychiatrists might start out by prescribing a stimulant that's immediate release and then see whether you have any side effects or how you react to that. And then they might move on to the extended release ones, which release the medication more gradually,
Mm-hmm.
phases.
Mm-hmm.
And those can last about 8 hours or more.
Mm-hmm.
So yeah, those are kind of the two classes of stimulant medications. The recommendation by people who specialize in ADHD and experts is to start with a stimulant because it tends to be more effective and to help more people. And then if that doesn't work, to move on to other like non-stimulants,
Mm-hmm.
other types of medications that could help people with ADHD. But because of misinformation and fear mongering, a lot of psychiatrists will start with the non-stimulant because they think it would be a better place to start because they think stimulants are harmful. And no medication is unharmful. There's always risks associated with medications, but it's a risk-benefit ratio. And so because of that, they'll start with a non-stimulant. And so examples of non-stimulants include Strattera and alpha agonists, including guanfacine and clonidine. And one thing that psychiatrist who actually talks a lot about rejection sensitivity dysphoria, and that's a concept I cover deeply in my book. He has spoken and written about how guanfacine can help that aspect of ADHD in people. Guanfacine or clonidine, trying one of the alpha agonists because they can also calm you down because they were initially developed as blood pressure medications.
Mm-hmm. Mm-hmm. Did you find that once you got the diagnosis that you were able to get effective treatment for you that was helpful?
Yeah, so I actually started with the Strattera with the first psychiatrist. I was I was totally open to try anything in the beginning. I just wanted help. But the Strattera, people react differently to it. Some people really benefit from using it. It's an SNRI, which is selective norepinephrine reuptake inhibitor. And I don't know if you've heard of SSRIs, selective serotonin reuptake inhibitors. That's the type of medication you would probably take if you're struggling with depression and or anxiety. And what those medications do is they block the reuptake of serotonin. So they basically make sure that you have like more little serotonin critters. It's a neurotransmitter, right? Little chemicals in your brain or between synapses at any given time because they block kind of like the serotonin from being in a simplified version, like metabolized. And so that's what the same idea for an SNRI, only it's doing that for norepinephrine. And for some people, they don't need more norepinephrine. And that was totally me because it made me feel very anxious. It gave me like chest tightness. I didn't sleep. I already was not sleeping well. I was really not sleeping well. I had like dry mouth and I really just tried to push through it and continue. And I did a few months actually. And when I went to my psychiatrist and told him that, and I was like, I'm ready to start a stimulant, he was very resistant to putting me on a stimulant. And I was just like, yeah, this is not going to work. So I switched to my
Good
current
for you.
therapist.
Yeah, good for you. I mean, so many people go to their doctor looking for that, treatment, and then they have to fight, you know, to get it. So I'm glad that you really advocated for yourself and was able to say, no, this isn't going to work. I'm going to go to somebody else that is listening to me and is going to help me, get the treatment that I need.
Right, exactly. Yeah, it's not like I didn't try either,
Right.
definitely good, to listen to your doctor and to try in
Mhm.
the beginning. And if it doesn't work, then
Right.
yeah.
Exactly. Exactly. Is there anything that I haven't asked you that you would want our listeners to know about your book or about women with ADHD?
Um, yeah, that's a big question. I guess, I really lean into like loving your brain, not to sound like cheesy, but I
Mhm.
think that once you learn about yourself, and I think the correct labels, like the right labels can really help. Like the parents I work with, they're often concerned that putting a label on their kid will make things worse, but people don't even realize like we're being labeled all the time,
Mhm.
and we're probably being labeled with unhelpful labels if we don't include a helpful one. Like, for example, kids and even adults with ADHD could be labeled as rude, inconsiderate,
Mhm.
dumb, slow. And it's like you
Mhm.
could have one of those labels or you could have ADHD
Mhm.
because, at the end of the day, it's like there's no secret. And if you think that if you're going out and seeking help, you know that something is wrong or that you need help with something. And so for someone to tell you, like, no, you're fine, that's a problem.
Mhm.
Because, I think at a certain level, you need to trust your gut, and maybe it isn't. Maybe it is an ADHD, right? But
Mhm.
I think understanding yourself and feeling confident in whatever information you have, and then being able to use that information to help yourself grow and thrive, that's probably the most helpful part. And
Mhm.
I think I make that message very clear in my book,
Mhm.
like leaning into your strengths, the things you're really passionate about, and working with your brain instead of against it.
Beautiful. Well, thank you so much for coming today and talking about this very important topic. I think more and more women are going to find that this is an issue for them, especially like you said, as they're going into perimenopause and menopause. I know I found that true to be myself. I had that, and it really didn't hit and cause major problems until I went into menopause. And then I had to have it, looked at. So just thank you for writing your book and getting that information out there and sharing with parents and young women so that maybe, like you said, they can love their brain and they can do it differently and they can get the help that they need. So
Yeah.
thank you so much for being here today.
Of course. Thank you again for inviting me, and I hope you guys found this helpful.
Yeah. All right, y'all, calling all women that you are suspecting you might have ADHD, or maybe you're in perimenopause and you're in menopause and the brain fog is more extreme than you think it's supposed to be. I know that's what happened for me. What Gilly had to say is very important. How many of us have to diagnose ourselves, right? It's so important to understand these possibilities for women. It is not the same for women as it is for men. And we are of an age, I think, where more and more women are educating themselves, they're advocating for themselves, and they're going and asking for assistance and help. So don't let the medical profession poo poo you. If you don't find a right professional that's really going to listen and attune to you and help you discover what's going on with you, go to the next practitioner. So please share this with anyone that you think that this will be helpful for. I know I will. And a really interesting fact that Gilly said that I did not know was that PCOS and neurodivergence have correlations. Very interesting factoid about that. So anyway, please share, as we've said, anyone that you think is beneficial, because what we're really trying to do is spread information far and wide so that everyone gets to learn how to live an elevated life. So thank you until we meet again. Thank you for listening.